All right. Thank you all for joining us at our second Nursing Story Slam event. Our one in January went so well and well received that we decided to do another one and do it in honor of Nurses Week. So I'm happy that you all were able to join us for the second Story Slam. So just to acknowledge again, those who are involved in putting this together was the Office of Nursing Quality, Development, and Professional Practice, the School of Nursing, the Office of Wellbeing, and Children's of Mississippi. So I'm now going to hand over to Dr. Mann to kind of go over the history of Story Slam. Arrows in the bottom left to advance your slide.
All right, thank you very much. It's a pleasure to be here with you guys again. I was briefly at the last one, and I was joking earlier that I can only stay for a few minutes, but the first speaker made me almost cry. So I felt like it was probably a good thing that I had to leave because I didn't know if I was going to be able to hold out. So the history of Story Slam, this actually comes from the physician world. The American College of Physicians around 2016 or so had a publication called On Being a Doctor, and it was just physicians would write brief stories about their experiences in medicine. But there was a decision made by ACP to turn those into live brief storytelling presentations, and that's what led to the beginning of Story Slam. And so Story Slam came to UMMC by way of Dr. Dick Wardrop, who was a faculty member in the School of Medicine, Department of Medicine, and had been heavily plugged in with ACP and I think a speaker and a moderator for Story Slams and so on. And so he actually talked with me about it and Sandra Edmont with the Office of Wellbeing and suggested this is something we could do here, which we did with medicine and pediatrics physicians. It was very well received. And then we had some conversations with nursing leadership here and school nursing leadership, and they were excited about the idea of doing this with nurses. And the first one really was great. So these are brief stories, about 5 minutes is what they typically are. And the idea is to try to, as much as possible, tell them rather than reading them. You have a PowerPoint slide here that I'm looking at, but the speakers won't have PowerPoint slides. The idea is for it to be more organic and natural. And this emphasis on narrative, and it can be a happy narrative, a sad narrative, a somewhere in between narrative. It's whatever your story is. And so I really look forward to hearing from all of you about what your stories are in nursing. And just want to say how much I appreciate all of you here, all the speakers, and just all of the nurses across UMC and nursing faculty. It's been really a joy to be able to work with all of you in the 6 years that I've been here as a faculty member. So let's see, I'm not smart enough to know. Click it, I don't know what to do. But
it's okay. You have one more.
Yeah. All right. And that's just a graphic of the ACT Story Slam slide. So I'll turn it over to Dr. Singford.
Thank you for the opportunity to say hello. It's a pleasure to be here and to hear the stories. I'm amazed and in awe of nurses. I think we especially feel that way right now as we're hopefully coming out of the pandemic, but I feel that way all the time. I think the work that nurses do just cannot be overstated, and it's so very, very important. This was an opportunity for us to collaborate between the School of Nursing and the medical center and the hospital. And we are very purposely working on ways to have partnerships. We want to bridge that gap between education and practice. We don't believe it's a good idea to have silos between academics and practice. It's very important for us to be one. And we hope you will gain from these shared stories. We hope that they will touch your hearts as much as they do ours, and that we can all learn together from them. Thank you for the opportunity.
And I forgot to introduce myself, but my name is Melissa Clam, and I'm an assistant professor at the School of Nursing. And so our speakers today are Nikki Karan. I'm sorry, I forgot to ask how to pronounce names. Karan, Kay Flanagan, Heidi Johnson, Yolanda Moore, Tara Price, and Camille Richards. So just for the sake of ease, we're going in alphabetical order. So Nikki will go first, and she's a nurse manager on 3C and 5C in pediatric hematology and oncology and pediatric surgery and cardiac step-down unit. And her story is entitled The Impact of Being on the Other Side of the Bedside.
Thank you. Like she said, my name is Nikki Cran. I'm the nurse manager on 3C and 5C. I started here at UMC at 19 years old. So I always tell people that I literally grew up here. Now I have officially spent more years at UMC than I haven't. So it's a great place to be for sure. I'm sure everyone knows the pivotal moment that they decided they wanted to be in healthcare. I actually it was a tradition of my family's to go to the movie theater on Christmas Day. That's kind of a strange tradition, but we did that. And it was Christmas 1998. We went and saw Patch Adams, which was a movie about a physician. And it was really the first moment that brought spiritual well-being to light, I think, in healthcare, or at least in my mind as a child. He used humor to treat patients, and it was based on a true story. And a quote by that physician was, "You treat a disease, you win, you lose. But you treat a person, I guarantee you, and you'll win no matter what the outcome." When that movie was over, I was like, I'm going to be a doctor. That is it. That is what I want to do. So I told my dad, I want to be a doctor. My dad is very frugal and conservative, and he said, well, you better get you some scholarships because that's going to be really expensive. So I did go and shadow career day. I was probably like in 7th or 8th grade. I went and shadowed a surgeon, and I turned green in the OR and passed out. So that was it. Couldn't do surgery. I started volunteering in the 3C playroom, which is the pediatric oncology hematology unit, when I was 16. And that is when I got to see what nursing was like. It was truly remarkable, and I knew that that is what I wanted to be a part of. So it came full circle for me in July of 2020. I became the nurse manager of that unit as well. And it was a very hard thing for me because it was a population that I was kind of unfamiliar with and a team that I didn't really know. I always kind of admired them from afar, but never thought I was probably emotionally stable enough to work with pediatric oncology patients. But my goodness, I have learned a whole lot from those patients and that team this year. Always really loved my job caring for the sickest children in Mississippi, but I think the moments that I spent at the bedside are really my favorite moments. May 2012, I came to work and I worked night shift, and I was 27 weeks pregnant, wasn't feeling too good. My work mom, Miss Pearlie Peoples, I don't know if some of you may know her. She has been here for a long time. I won't say how many years. She looked at me and said, "You don't look too good. Are you okay?" And I said, "I'm not really feeling good." And she said, "I think you should sit down and prop your feet up. They look like, they're swollen." And she was right. Her intuition, that nursing intuition, never wavers. It doesn't matter if you work with children, what, you always have that intuition. So I rested for a little while, and about 30 minutes later, I decided I was going to get up. I had a lot to do. I had some sick patients, and actually collapsed in a patient's room and seized. So I was eclamptic and went into HELLP syndrome. I delivered my baby at 27 weeks, 1 pound, 13 ounces. I remember being rolled into OB receiving, and the nurse's name was Lindsay. I'll never forget her. I said, she said, "Your blood pressure is super high. I really need you to, just rest, and we're going to lay you flat." So can you just give me some labetalol? I really have a lot of charting to do. I haven't even seen it, but one patient one time. So ignorance really is bliss sometimes, because poor Lindsay looked at me and said, she sat down and she looked at me right in the eye. She said, "You're gonna have a baby. You're not going back to work." She never left me. Lindsay and I actually became really good friends. She's not here anymore. She went traveling, but we are still very good friends, and she hasn't missed a birthday party of my child's, or kindergarten graduation, or any of those things. So it's been, that was the start of our very fruitful relationship. I was obviously very sick and actually stayed where I could not leave leave labor and delivery for about 16 days, which is almost unheard of. But I got better. The NICU nurses brought me pictures of my baby. That's actually the picture on the screen, is the one that they brought to me in the room. That's really scary, even as a nurse, for me to see. I don't think any of my medical knowledge could have prepared me for when I walked in the NICU and saw his tiny body hooked up to all those machines. But I think what really got me through that journey, 4-month-long journey, is the nurses in the NICU. And I mean, from teaching me how to pump to prayer, it was just remarkable. They do really good work there. So we got to move to a brand new NICU this past year, which has been amazing to see that there is never a mom that has to leave her baby. That was probably the hardest thing. I would fall, you can't sleep at the bedside in the old NICU. You could not sleep in the bedside. And I would fall asleep and they'd wake me up like, "You gotta wake up." So now they have a place for mom to sleep with her baby or near her baby. And it's really a great place to be. I can't really put into words how different it was for me to wake up at night to a breast pump instead of a bouncing baby boy. But I don't think I would have gotten through it without, being able to call and always getting that answer from the NICU nurse, assuring me that my baby was okay, and not to worry, they were going to take good care of them. I think being Deuce's mom and I have a little girl, it's been the best journey that I've been on, but I do believe that it has definitely changed me in the kind of nurse that I am, because now I can truly relate to my patients. I've been there and I've been scared, and I've gotten those heart-stopping 3 a.m. phone calls telling me that I need to come now because they're having to re-intubate, or they needed me to come to they needed me to come to be with him. It built a lot of character, and the compassion and the empathy that I have for families truly is deep rooted from that experience for me. Deuce is now a healthy 8-year-old. He loves school. He does not like to miss school, which is abnormal for kids his age, but he loves school and he loves Roblox and basketball. And those of you that are friends with me on social media, if y'all saw his Mother's Day letter, he loves his mama. I hung the moon for him. So he is also really honest, and his kindergarten graduation, he was asked what he wanted to be when he grew up, and he said he wanted to be an adult so he could drink all the beer he wants like his mama. On the microphone. We're Catholic. I couldn't be more thankful for my profession. It is truly the best job in the world. I have 2 great teams. Shout out to them, 3C and 5C. They're so supportive, and they truly carried me through. They carried me through this hard time. I had coworkers come in and washing my hair and braiding it so it would not get tangled, and bringing me food. And then, I mean, truly, it's like a family. I also have to say, Dr. Famuyiwati, who is now the division chief, I think I'm sorry if that's not right, but she's over the NICU now. She was our our physician during that time, and she has really changed the NICU world for the better. I've seen it. It's been great to be a part of it, and I'm very thankful for her too. But I just want to say, as we healthcare providers go through this hard season, and it's been hard, it's probably going to be hard for a little while longer. Hopefully it'll turn around soon. I think we should just remember to celebrate the small victories, and just know that the patients might forget your name, but they're not going to forget how you made them feel. And I'm a true testament to that. I remember each nurse and provider who truly took a moment to pray with me or comfort me, just be there for me. And that's truly the remarkable part of nursing, I think. So.
Thank you, Nikki. Next we have Kate Flanagan. And she is the nurse manager for the nurse resource team in the nursing service office. And her title is boiled weenie water. So it should be interesting.
Thank you guys for letting me be here today, and I know I've got some splaining to do. So first, I just want to say happy Nurses Week to my colleagues and my coworkers and my teammates on the nurse resource team. But I do need to explain what boiled weenie water is. And this is going to date me, so just hang in there with me. I, like Nikki, have grown up here at UMC. I went to school here. I was a student nurse tech in the SICU. I transferred to 2 West as a student nurse tech, and then when I graduated nursing school, went to work on 2 West. And that's where this story will unfold. It was in 1992. It was Labor Day weekend, and our crew decided that we were going to have a big luncheon. Well, I was the new kid on the block, so they included me. They asked me to bring dessert, and I thought, I am going to wow these people. They're going to love me. So I went home, and I lived in the country, folks. I lived way out in the country, but I went to the grocery store after my shift, and I decided I was going to make a fruit pizza. I don't know if any of y'all have ever had fruit pizza, but it's beautiful when you do it just right. So I fixed this fruit pizza with my strawberries and my blueberries and my pineapples, and it was a work of art. And I took it to work the next morning and put it in the refrigerator, and everybody was oohing and ahhing over my fruit pizza. Okay. Well, as the day goes on, I'm thinking, when is lunch? I'm starving to death. Well, I had gotten left out. They all went and had lunch. I'm running all over the floor, catching call lights, catching the phone. And I really don't even realize that I am the only soul out on the floor running and catching lights and phones. Until there were so many going off that I was like, where is everybody? And I opened the door to the break room, and they're all in there with their spread and my fruit pizza, by the way. And they're all having lunch and giggling and talking. And at that moment, I thought, golly, y'all have left me out. You know, I'm a new graduate at that time. I was in orientation. So I'm thinking, now I understand what they say about people that eat their young or they exclude people. And I thought at that moment, well, first of all, kind of walked out and I said, I just need a little help out here. I need somebody to come help me out here. So they finally got up and came out and helped me with the patients. One of them said, after they all came out of the room, you know, they had been in there quite a while, so they all came out, and we had a stock record clerk back then, and she came up to me, she said, honey, we've left you some lunch on the table. I said, well, I'll get to it in just a minute. So I go in the break room, and in the center of that long table in the break room is a bowl, and that bowl has one weenie floating around in boiled water. And I thought, now I'm not bougie, and I'm not too good to eat a wiener floating in water. However, you know, I came from a family we didn't have much, but we did not eat shriveled up wieners floating in water. So I was like, thanks, but no thanks. And I thought, I'll go eat my fruit pizza. I can get a slice of that without eating every bite of it too. So at that moment, I thought, I'm not going to be this type of nurse. I'm going to be the type of nurse that includes people. And when new people come on the floor, I'm going to welcome them. I'm going to take them under my wing, and I am going to take care of those people. And I guess, I find myself in a very unique position with the float pool because that's kind of what we do. We float around to all the different units. We never know what unit we're going to be on until we come in that morning. So it's funny how I got placed or how I wound up in this position because I have managed a lot of different units and a lot of different floors. But for me to be able to do what I do now, and I've almost been there 5 years in this role, I feel like I have the capability of taking people under my wing and always making people feel special and wanted and part of a team. And y'all, it's easy. I shouldn't say this, but I can because I've been there. I've had different units. And it's easy when you have everybody right there in your grasp to make feel like they're part of the team and they're a teammate and how special they are. But try doing that when your folks are all over the place. And I feel like we do a really, really good job with the nurse resource team in including people and making them feel like they are part of the team because they are, and they're my second family. So with new graduates coming out, student nurse externs coming out, new employees coming to join the UMC team, we've got to do better than to serve people with boiled weenie water. If we want people to stay, we have to roll the red carpet out and we've got to make them feel like they belong. And I guess that's the moral to my story is we have to make the effort to get people to feel welcome and that they belong to a bigger team and that they really are important to us. You can recruit all day long, but you got to learn how to retain. And that's, if you can ever figure that out, that is the end goal, is to retain what you have recruited and worked so hard for. So that's my story and I'm sticking to it. And I appreciate y'all letting me talk to y'all today.
Thank you, Kay. Our next speaker is Heidi Johnson. You can start walking up here. Heidi works in the pre-anesthesia testing over in the medical mall, and her title is Born to be a Nurse.
All right, y'all, I do have note cards. I come from a long line of storytellers from North Carolina, as you can tell from my accent. And so I want to keep on topic because I can really chase a rabbit. I was born to be a nurse. For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope in the future, Jeremiah 29:11. And here's my story of how God gave me a hope in the future. I was introduced to medicine very early on when I was diagnosed with malignant sarcoma of my cauda equina at age 1. To make a long story short, the surgeon, did as much as he could to get it all. It was wrapped around it's a nerve sac at the end of your spine, and he feared paralysis or worse, so he just closed me up. He got as much as he could. I don't remember, I was 1. But I then went through cobalt treatments as my treatment. I guess chemo wasn't there back then. A year later, it metastasized to my right arm. I do have something to show. I didn't bring any objects, but I have half a right arm. They were able to, this was age 2, get all of that, but more cobalt treatments to my right arm. Throughout my childhood, I was taken to surgery umpteen times for normal childhood illnesses. I have scars to prove them. When you have a cold, you have enlarged lymph nodes, but now I don't have them anymore because they were afraid the cancer had come back. Constipation. I don't know how many young children have scopes, but this still did. So I was in and out of hospitals a lot. So naturally, from an early age, I wanted to become a teen. They took such good care of me. I was always around nurses and doctors in and out, in and out. And I wanted to be a nurse. I also promised God that I would give back. I would give to those that were sick and needed compassion and caring. And I also promised him, and I stand here before you today, that I would give my testimony whenever the opportunity arose, how he saved my life. At age 14, my mother told me, I guess it was time, that I could never bear children because of the cobalt treatments. And so it ended up, she was right. So early in my nursing career, I did go to nursing school here. I lived in the dorms in the 80s, and so I lived at UMC. But I found myself in an OB/GYN clinic really early on. And there were times that, I wish I could feel a baby move, and I would have times like that, but I got over it. I learned to live through my patients as they were excited and joyful, and just threw myself into that. Well, God put you where you need to be, and in that OB/GYN clinic, I obtained 2 babies of my own, and so I am a mom to this day to grown men now. But anyway, they became sick a lot. They were in daycare because I worked full time. But the good thing about nursing is it's very flexible. I was able to stay home with those boys 12 years and never miss a beat in nursing. So I transferred to be a weekend labor and delivery nurse. That was another thing with having babies, but I threw myself into that and got to celebrate in other ways with the children, the babies being born and taking care of the newborns. I just loved it. And even delivered a baby myself one time, but that was an accident. It just fell out. So then and the next comment comes from a close person in my family, my sister. She told me, you don't know what you're doing. You've never had a baby. And so I became a childbirth teacher. I thought I knew enough to teach the parents, and I love teaching parents, and I focused them on the dads, and we had fun. This is how you take care of her. And then I became a registered lactation consultant because I wanted the babies to eat well, and I really enjoyed helping the mothers with that. But I told my sister, I said, I know many a good OB/GYN that have never delivered a baby, and they're male. So anyway, don't get me wrong, in my 32 years, I have taken some wrong turns. My wrong turns were pediatrics, but some of y'all's may be OB. But anyway, loved lactation, loved childbirth classes, but I started looking around. My children were thriving. They can take care of themselves. So I said, it's time to get a full-time position. Look at this age. I need retirement. I need something. So I took a few wrong turns into pediatrics, but God led me to UMC to reproductive endocrinology and helping ladies with IVF and to get pregnant, infertile ladies. And 20 years before getting that job, I came here, saw Dr. Cowan, and went through IVF too. We were the first sister, the main sister that said that comment, did donate her eggs to me. And when my husband's gametes saw her gametes, they just went, woo, he freaked out. And so they did not fertilize, but God had, a plan. And in doing IVF, and it many a times does not work out. More that than it does. I was able to be there for my patients, and I knew the emotional roller coaster they were on, and I had been there, and I was able to, when it didn't work out, say, I know I've been there, and that meant a lot to them. So, so I'm getting older in nursing, and I started feeling it in my back. And many of us do eventually have back problems because we lift and pull and push our patient. But I'm starting with half a back. I really have half a back. So I said, I need a desk nursing job. And actually, there are some. I work in pre-anesthesia testing. Hopefully, the last job I'll ever have because I absolutely love it. We have locations all over UMC and off campus. And I said, can I please have the Cancer Institute? And so I call that coming full circle. And now I wear a yellow ribbon for sarcoma. And now there's another little story, the zebra ribbon for neuroendocrine tumors. But anyway, that's a whole nother rabbit. But just last week, I had a young man in his early 20s. He came in my office with his pastor, and that's very unusual. You usually have a loved one. And so I started to interview him and get his history. He had sarcoma of his left arm, and it had metastasized as well. And this old lady held up her right arm, and I was able to give him hope. We were all in tears just last week, praising God. And he looked at this old lady that had survived sarcoma twice, 54 years ago. So it was a precious moment. As I conclude, I just want to leave this message. Go where God leads you. And even the wrong turns will get you ready for the next phase. And I had some of those. But bloom where you're planted, and just God bless. Thank you.
Thank you. Thank you, Heidi, for sharing your story of all that you've done as a nurse. And then next is Yolanda Moore. She's the nurse manager of Women's Urgent Care. So I feel like we're going to flow right from one story to the next, aren't we? So Yolanda's title is Hope and a Future.
Thank you for having me today. To give you hope and a future. Those are some of the words from one of my favorite scriptures in the Bible, Jeremiah 29:11. And as healthcare professionals, I truly believe that that should be our top aim, to give every patient hope and a future. So today I want to share a story of such. It was a frigidly cold morning in February some years ago when a husband and his expecting wife woke up to some conditions very similar to the conditions we found ourselves in the ice storm of 21, if anybody remembers that one. So this husband and wife got together to talk through how to safely get his wife to her prenatal care appointment. Now, she had been pregnant before, so she knew the importance of going to her doctor's appointments. She knew her OB team very well. They knew her. So they decided that it was worth it, just so that mom and baby could be safe, that they would carefully go and make her appointment. And I'm so glad they did. So they made it safely to the appointment, and the provider and the nurse did their assessments and decided that that day was the day that mom would be sent to the delivery suite for her delivery. Now, she wasn't that cookie cutter patient that we all long for. She had several things working against her. She was young, she was poor, she was Black, with little education. She had only made it through high school at that time. To be honest, she fed her children by the grace of God and through the help of the government, better known as food stamps. The only insurance she really knew was that free insurance, that Medicaid insurance. On top of that, with her health history of chronic hypertension, and like a number of Mississippians, she was a little bit overweight and dealt with diabetes. If that wasn't enough, her pregnancy history was just as complicated. So I mentioned that she had been pregnant before, but it didn't tell you how many times she had been pregnant before. She was a gravida 9, so this was her 9th pregnancy. And some of those previous pregnancies were complicated. There was a preterm delivery of surprise twins. She said they didn't have ultrasounds back then as they do now, so it was a big surprise. She also had a history of a STAC, or emergency cesarean section. She just said she started having heavy vaginal bleeding. And to this day, no one really explained to this mom why she had this bleeding. She just knew it ended up with a STAC C-section. So on this cold February, she was going back into the hospital to have a repeat cesarean section. It would be a high-risk delivery. But thank goodness to a wonderful and amazing OB team of nurses, and doctors, and anesthesiologists, doctors that will come together to be able to render the care that this family needed. They safely delivered mom and baby and got her through most of her postpartum days here in the hospital without any complications until one day she just dehisced. Her C-section wound opened up. They were unable to correct it, but there again, that OB team came to that mom's rescue and helped patch things back together, teaching her how to properly clean and stabilize the incision. With time and by the grace of God, with the help of her family, she would go on and mend, and her and that baby would go on and thrive. This mom and baby were given hope and a future. And I'm sure the healthcare staff had no idea that years later, this mom would actually go back and complete her college degree and become a nurse. It's likely that they never imagined, as the years passed, when she would come back and forth with all of those babies, that they were helping to bring into this world principals and teachers within the Jackson Public School District. There were even professors and chairs of departments of some of the greatest HBCU universities of the South. Shout out to Prairie View and Jackson State, the Jackson State. They likely never imagined that some of those deliveries were social workers and recreational therapists and those with advanced degrees in public health and environmental science. That STAC C-section yielded a baby girl who would go on to be a nurse practitioner, who is actually working on her doctoral degree at this moment. And in the winter storm of '85, that delivery of that repeat C-section, that mom called her hope Yolanda. And that's me. Here at the University of Mississippi Medical Center, me and my family were given hope and a future. And I find it ironic that in these times, the United States and the state of Mississippi are facing maternal mortality rates that are rising at unforeseen levels. But yet, here at the University of Mississippi Medical Center, we are providing a hope and a future. To every healthcare professional, what you do matters. And I come to remind you that you have an important role of providing every patient a hope and a future. Thank you.
I won't lie, I got a little bit poopy on that one. That was great. Okay, so Tara Price is our next presenter. She is an instructor at the School of Nursing here at UMC, and her title is Nursing Life, Lemons, and Lemonade.
As excited as I am to follow Yolanda, it's also a little bit nerve-wracking. But I will follow her and actually just tag on to what she has presented. Thank you for having me. I'm excited to be here. My nursing career actually started in 1992 when I became an LPN, but my nursing story started in 2001. I graduated from University of Mississippi Medical Center School of Nursing in 2001 with my BSN, and like most, went on and passed NCLEX the first time, yes. Celebrated that passing and that licensure, and we really celebrated because 6 weeks later we were told we were expecting. And you'll catch that in a minute. But at the time, my husband and I had a 6-year-old. And so we were excited about this news. We got a little more excited when we were told it was twins, because that's not in our family. That doesn't really happen. Then we got a little bit nervous because we were told it was twin-to-twin transfusion syndrome. Now, I was an ER nurse. I didn't know anything about OB. Didn't enjoy it, didn't like it, made B's in school. It was not my thing, okay? So long story short, we began a process of fluid reduction techniques. We were given the option, now this was 20 years ago, we were given the option of an experimental in utero surgery. We opted out of that because it was all or none. Either both babies would survive or both babies would live. We could wait and watch, which is always an option in healthcare. Or we could start some fluid reduction procedures, what we know as amniocentesis. And that's what we opted for. So 12 amniocentesis later, yes, I'm now the queen of that, I think. That's what Ken Perry says anyway. We began to see some progress or some improvement. And so around Thanksgiving of that year, we began to hold those procedures and hold off and wait and see. And things held their own. Well, on December 7th of that year, I had an appointment for an ultrasound. My husband was scheduled to go with me that day. My mother had gone for every other appointment because I was going for a scan, going for an amnio, and I was coming home. And he was going to work because sooner or later he was going to need to be off. And so he was going with me. I said, be sure and grab my glasses, my contact case. And he's like, why? We're going for a scan. I said, nah, I need you to grab those things for me. I said, we're not coming home. He said, okay. So we got there for the scan, and I heard Judy, the sonographer, I heard her say CHF. And if you don't know what twin-to-twin transfusion syndrome is, in a nutshell, it's one placenta, it's 2 amniotic sacs. So you have 2 babies that are fighting for nourishment, they're fighting to grow. One gets everything, one gets very little, if anything. So there's a high probability that one won't survive and maybe both won't survive. So if you get to 28 weeks, you're doing really good. So at this point, we're 26 weeks and 5 days on this Friday, Pearl Harbor Day. And at this point, she says congestive heart failure. Well, Dr. Perry was very transparent with me from the beginning. He never held anything back, probably because I wouldn't let him, because I asked a lot of questions. And he said, I'm going to send you over, like he did many, many times, for monitoring. We got to the hospital, they hooked me up, the nurse is doing her thing. And I don't think I knew exactly what was happening until the anesthesiologist walked in and said, what time are we doing this? And then it hit me. We really are about to have babies. And I lost it emotionally. And I'm not an emotional person. If you see me crying, I'm probably mad and you should probably back away. Okay, I'm just telling you, all right? So at that moment, that nurse popped that tourniquet off my arm, took her gloves off, she grabbed my hand and she began to pray. She didn't ask, she just did it. At that moment, it wasn't about skill. It wasn't about her GPA. It wasn't about where she went to school. It was about meeting my need at that moment. And that has never left my mind. I would say we rolled across the hall to the OR, but I walked into the OR, okay? Mainly because I wanted to. Got into the OR. We had 2 beautiful baby girls. Keely was 2 pounds and 6 ounces. Chloe was 1 pound and 7 ounces. And yes, they were very unstable at the moment. Keely was probably the most unstable. She was the one in heart failure, massive ascites, had a heart rate of close to 200. Things were very touch and go. Chloe was my stuck twin. She was the tiny one that didn't have any kidney function. And on Monday, we had to say goodbye to her. So in that moment, in that experience, her name was Chloe Faith. We let go of a little bitty bit of faith to learn what a huge faith was. And 82 days later, Keely came home to us. She'll be 20 this year. But because of that life event, but because of that experience, my whole nursing focus changed. Didn't I tell y'all I was an ER nurse? Yeah, didn't like OB, didn't care at all about it. But I went on to get my nurse practitioner in women's health. I became a labor and delivery nurse, and that's what I teach here at UMC now. So I've told my kids and I tell my students, you can do anything you set your mind to, but you might not do that for the rest of your life. So when you come into nursing school and you tell me, I'm going to be a peds nurse, that's great, but watch out, because you may end up doing the very thing that you think you're not going to do. Okay. As a matter of fact, 2 months ago, one of my former students, when I taught at a community college, he reached out and he said, hey, will you write me a recommendation? I'm going to psych mental health NP school. And I said, well, certainly, by all means. But he immediately began to say, if you're not comfortable because of my past, I'm okay with that. Well, he's an Army veteran and he had some PTSD and he had a hard 2019. But that was a life experience that opened a door and changed the trajectory of his nursing career. And he sees that as an opportunity to meet needs of veterans who need psych mental health. So why do I say life, lemons, and lemonade? Well, you've always heard the saying, when life gives you lemons, make lemonade. Y'all, I hate lemonade. I don't drink it. It leaves a film in my mouth. But what I realized is the lemonade's not for me. The lemonade is to be made for those that we serve and for those that we care for. And with these students, the past 2 years, I want to open their brains and I want to open their hearts and I want to pour my passion for nursing into them, but I can't because they have to have their life experiences, whether it's personal or professional, to formulate their own passion for nursing. Thank you.
Thank you, Tara. Camille Richards is our next and last presenter. She's the executive director of University Heart, and she was also on the newsletter, wasn't that today? So you get a double dose if you open your newsletter today. Her title of her story is Save the Starfish.
Thank you so very much. I am extremely honored to be asked to do this. Number one, because most people know me as an executive director and not as a nurse. I'm here to tell you that I am always a nurse first. I believe that's pretty much why I got this position, is because I think a little bit differently, and I think a little bit more of administration needs a little bit more nursing ideas. So my topic today is Save the Starfish. I have had an amazing career as a nurse. Next year will be my 30th year as a nurse, and last year was my 20th year as a nurse practitioner. I can't believe it. Time has flown. I have seen so many things in my career. It's very interesting listening to all these stories. I've never had any babies. I've been through in vitro. I have had cancer. I have been a patient. I have been honored to be cared for by some amazing nurses. I have taken that and applied it to what I do. And I'm very grateful that I continue to do that on a daily basis. And I think all of this, that's the point that everybody can take away from this, is that we have all learned based on the touch of another nurse. So my story starts actually across the street at Baptist Hospital. I started the transcatheter aortic valve program over there. TAVR is one of the most amazing things that I've seen in my nursing career. Believe it or not, I was back at UVA in the late 80s when laparoscopic surgery started. I thought that was amazing. You could do a lap chole in 4 hours flat and the patient got out of the hospital. Now, of course, it's done in 20 minutes and they're out of the hospital in an hour. But really, I've seen some amazing things in surgery. But TAVR stole the show. Think about somebody who has lived a life and calcium is built up on their artery. On their aortic valve. That valve cannot open and close well enough to get blood to the rest of your body. Typically, it happens in older adults. And most of these adults, they've either had open heart surgery before from bypass or can't have surgery. Maybe they've had cobalt radiation because of breast cancer. They can't have their chest opened up. When TAVR came about, it was FDA approved for the sickest of the sick, the inoperable patients, the patients who absolutely could not have open heart surgery. You had to be seen by 2 surgeons. And whenever Baptist, if anybody know about the Baptist surgeons, they'll operate on a stone. They can make a stone live. They do a great job, but it was very hard to find those inoperable patients. So we screened 75 patients to get our first 5. We did our first 5. We started cranking them out. Now these patients, because of the technology was new, you had to have an iliac the big as my thumb. You had to have just enough calcium to keep the valve in place, but not too much that you couldn't cross the valve. Now think about this. This is all done through the groin. This is done through a heart catheterization procedure, putting a valve up and over, all right? The only one that was available was transfemoral. So going through the groin, go up and over. Screening these patients was tough. It was a lot of tough studies that had to be done. Echocardiogram, carotid ultrasound, heart cath to make sure there's no other problems, usually PFTs, all these other things. And these older folks just were worn out by the time they got into the testing. Then you tell them, now we're to go through with this new procedure. Can't really tell you what your 5-year expectancy is because it's only been done for 5 years. So it was really tough convincing patients to go through this and convincing their families. So probably, I think it was our 12th patient over at Baptist. I'm going to call this patient Mr. G. Mr. G touched my life. He just lit up. He'd walk in the room, didn't want a cane, didn't want a walker. I can do it myself, Miss Camille. His daughter was a school bus driver and they lived down south and they were just dynamite. Loved them. He was the primary caregiver of his wife. I'm going to have this procedure. I'm going to get home and I'm going to take care of her. Great. Went through all of the things, did all of my teaching that I needed to do. No problem. I'm up for it. Go get your heart cath. No problem. Get your CAT scan. No problem. Problem was when we looked at that CAT scan, we noticed a big chunk of calcium on the aortic valve. Okay, we're expecting some calcium. That's the whole reason why we're doing this. But it was a little bit off center. Go to the day of the procedure. Great iliacs were able to get up there and get around the aortic arch. We couldn't cross the valve. We couldn't get that 2 centimeter squunched down valve to go over that chunk of calcium. Well, back then, TAVR was so new, there wasn't all these retrievable items that they have now that you can really, really help figure out which way to do this and how to get around this and angle this way. It was really a one-shot deal. Once you get that valve out of the sheath, you have to deploy it somewhere. If you can't cross the valve, you're not going to deploy it over that damaged valve. We worked for 2 hours. This procedure, we got down to 45 minutes. We were in there for 2 hours and realized we were not going to be able to cross that valve. As we kept on going, having this big valve across this pressure started dropping. We cannot keep going. We decided to pull back and we decided to deploy the valve just north of the iliacs in the descending aorta in a place that it wouldn't even function as a valve. As the blood would pump, it would open and close, but it wasn't in the position. We just had to get rid of it because if you would have pulled it out for the iliacs, you would have torn the iliacs. Not an option. So we deployed Mr. G's valve in an unideal place, pulled him off the table, woke him up after general anesthesia, and told him, Mr. G, I'm sorry, we weren't able to put that valve in. You're gonna have to stay in the hospital for a day. We'll have to figure something out. This is our only option. You can't have open heart surgery. Mr. G lost his faith. He tanked emotionally. His daughter came to me every single day and said, I don't know what to do. I took him home. He cannot care for my mama. I don't know what to do. He's ready to call in hospice. To make matters worse, because of his severe aortic stenosis, he ended up getting pleural effusions. We had to have him come in every other day, and he lived in Macomb, so we would be able to get him down there and get tapped every other day. That was driving him insane. Finally, we brought him up to Baptist and we had a Plerex catheter put in so that he could kind of monitor. And over the next couple of months, he could see that drainage kept on coming out. And he would drain it every 2 days. And okay, drainage is down to 50 cc today. Oh, tomorrow it's back up to 75. Just kept on getting depressed, kept on getting down. During this time, the FDA then approved TAVR for a different access called transapical. If you think about where the heart is, it's sitting right here, and the apex or the bottom of the heart is down here to your left side, kind of in your apical area, fifth intercostal down. We said we can do this procedure for him going in through the apex because, think about it, you're crossing the valve with the flow of blood. So you don't have to go against the flow and knock into that big old piece of calcium. We can do this. Took a lot of convincing to get Mr. G to go back to the Baptist and back on the operating room table, but he did it. It was the fastest transapical done in the history, and it was our second one. We did it in 45 minutes. He did great, but the pleural effusions kept coming. Now remember, we still had that Plerex catheter in, but this time, week after week, he did see a gradual decline in the amount of fluid because he had a functioning aortic valve. He started gaining hope. He started getting faith that I'm not going to have to keep on coming back in for procedures. I am going to get better, and I can go back to being the primary caregiver of my wife, and I don't have to rely on my daughter. Over 3 months, we finally saw him turn around. His valve was functioning great. His EF went back up to 50% from 35%. He was thriving. At this time, I left Baptist and I came to UMC. I started another TAVR program just because one wasn't enough, and the adult congenital heart program. And I was not able to kind of be as connected with my patients as I was over at Baptist. But he followed me, not in the best way. He had a car accident. At this time, he was 92 years old. Had a car accident. His PCP, Dr. Meeks over at Geriatrics, had him come here. He had a fractured neck. They brought him in. Neurosurgery said, we got to do surgery. When they looked at his old echo from 3 years ago, oh, we can't do surgery. He's got severe aortic stenosis. Daughter calls me, Camille, I know you're at UMC now. You got to help me. You got to help me. They're not going to operate on Daddy because they said his valve is too bad. I called and said, yeah, I'll do another echo. Guess what? Next day he had neck surgery. I didn't even have a hand on him as a nurse practitioner, but he was able to have his surgery completely functional, no residual neuro issues, got out of the hospital, went back home. The next week, I got a letter in the mail from Mr. G's daughter. She sent me a card and it had a story in it. And with that card, there was a necklace. On that necklace, there's a starfish. I wear this a lot. The story goes like this. Y'all probably have heard this before. This is a great story, and it's called Make a Difference, but I call it Save a Starfish. One day, a little boy was walking along the shore, and he saw some starfish washed up on the shore. And he knew it was going to be a hot day. He picked it up and threw it back in the water. Old man walks along behind him, looks up, looks at all the starfish, looks at the hot sun, looks at the boy and says, boy, what are you doing? It's like, well, it's going to be a hot day. The tide's going out. And if I don't pick up this starfish and throw him back in, he's going to die. Picks up a starfish, throws it back in. Old man laughs, rolls his eyes. Boy, you can't make a difference. There's miles and miles of ocean, of beach, and there's way too many starfish. You can't make a difference. Boy looks at the man, respectfully says, sir, I disagree. Reaches down, picks up a starfish, throws it back in the ocean, and says, I made a difference for that one. That story will never leave me. I never gave up on Mr. G. Mr. G did give up time and time again. His family never gave up. I don't care where I am. I don't care what hospital I'm working at, and I've had a very extensive career. I will always put my patients first. I will always be a nurse first, and I will always make a difference by throwing another starfish back. So please, please, every day when you get overwhelmed And every day when you think it's too big of a hill to climb, I'm not making a difference. There's too much red tape. In administration, I can say that very, very, very clearly every single day. There's a lot of red tape, but I know every day I make a difference. Every day, throw a starfish back. You can make a difference. Thank you all for everything you do.
Thank you, Camille. That was a wonderful into our stories. Heather Pierce from the Office of Nursing Quality and the rest of that title. Is going to come present some pens and a water bottle as a thank you to our presenters. But also just want to remind the participants who have been watching that you'll get an email in the next few weeks about claiming your CE for coming to the Story Slam today. So just be on the lookout for that. So here's Heather. Thank you. I will leave my mask on since I'm going to be calling you up here to get a pen, but thank you all so much for agreeing to share your stories. I know being vulnerable and kind of putting yourself out there is very difficult. I don't envy you in that. I hope that you got something out of it because we certainly got something out of it listening to each and every one of your stories. I love hearing about how being on the other side of the bedside has impacted your career as a nurse. I love hearing about Kay's story, and I learned a new phrase, don't treat people like they're boiled weenie water. And that's so true. Like, we've got to welcome everyone to UMC and treat them like a team member. They're not disposable. That's what I heard. And then I love hearing just stories about treating every patient individually. And if you save one, you have impacted and changed the world. So thank you each and every one of you for doing this. We do have a pen. It's a little microphone. It's a real cute pen that you can wear on your badge if you choose to. And we hope it reminds you of this experience and sharing your story. And then we hope it's also a conversation piece. So when people see it and they ask you about it, you can share this experience and even encourage others to do the same. It may not be this avenue of getting in front of a microphone, but just being out there and sharing your experiences with people helps people grow. So thank you so much. First pen, Nikki Karam. There's you a pen and a bottle. Thank you so much. Kay Flanagan. Okay, thank you. Yolanda Moore. Heidi Johnson. I think I messed up alphabetically. Sorry about that. That's okay. Sarah Price. Thank you so much, Sarah. And Camille Richards. Thank you so much. Thank you again. Another last round of applause. And thank you to those of you that tuned in via WebEx. We appreciate it. Y'all have a good day.